It's been called the Canadian disease because if you live in Canada and are between 20 and 40 years of age, you have a better chance of getting multiple sclerosis than in almost any other country in the world. The blurred vision, speech defects, crippling or paralysis of MS have been researched for decades, but no one has yet determined a cause for this disease of the nervous system, let alone come up with a cure. As for treating MS, doctors can't agree on the best way to do that. Some recommend tough bouts of chemotherapy, while others look to something simpler, like a special diet. But the 50,000 Canadians who have this disease aren't looking for a cure or for MS to be eliminated. They just want something that will keep them from getting worse. The University Hospital in London, Ontario is the headquarters for one of the world's largest and most expensive studies into the treatment of multiple sclerosis. Now underway here and at 8 other medical centers across the country, the purpose of the experiment is to determine if a powerful drug called cyclophosphamide can control MS by suppressing the body's immune system. At present, cyclophosphamide is used mainly in chemotherapy for severe cancer cases. Ron Smolders, who's 35 and who suffers from a severe form of multiple sclerosis, is one of the 170 patients in the study. He's in the group receiving high intravenous doses of cyclophosphamide. He says he volunteered because of the rapid progress of his MS.
I was getting worse, and according to the doctors, they didn't think that there was much chance of me being another 2 years without a wheelchair, and I saw it myself. So this is a chance of me getting better. Like, if not better, it's going to stop me from getting in that wheelchair.
Is that right, sir?
Yes.
Dr. John Noseworthy of the University of Western Ontario is directing this experiment. It will cost more than $1 million, the money coming mostly from the federal government with other support from drug companies. And because of the possibility of dangerous side effects, those patients on high doses of the drug, such as Ron Smolders, have to be closely monitored during their 4 to 5 week hospital stay. Although cyclophosphamide is already being used in many MS clinics, and though some research has been done in Europe and the US, there is yet no conclusive proof that it's effective for multiple sclerosis. What hopes do you have for your study with cyclophosphamide? What are you trying to find out?
Clearly, I hope that it alters the natural history of MS for those patients who received it, if that's the truth. If it isn't the truth, I hope it's definitive that it doesn't work, and we can then move on to another area of research, and that we'll spare those patients who would subsequently come down the road and be getting those, what would then be useless treatments, from having them. I hope we get a definitive answer.
2 weeks after his drug treatment is completed, Ron Smolders returns to the hospital for a checkup.
How are you?
He has suffered one of the most common, though temporary, side effects of cyclophosphamide, total baldness. A series of neurological tests will establish the rate at which Smolders' MS is still progressing.
Feel me touching? Yeah. Here and here? Yeah. And Ron, make fists and hold your arms up. Hard as you can. Hold them up to the side.
Smolders and his family live in Blenheim, Ontario, between Windsor and London. They've been told it will be at least 9 months before they know if the cyclophosphamide will work or not. Ron's wife, Robin, has had to get a shift work job in a machine shop because he can't work anymore.
How's your day?
Oh, pretty good, I guess.
It's easier now that his hair has started to grow back, but Smolders' sons, Matthew and Sean, still have some difficulty dealing with the effects of their father's illness. Ron's disease is centered in his brain and spinal cord. Lesions or plaques in the nerve fibers disrupt signals to his eyes, arms, legs, and other body functions.
Well, my legs are the worst. I can barely walk without limping. And I'd say from about August to December, I can't remember anything that happened. It took my memory right away from me. And, well, I couldn't even do anything. I'd come downstairs after getting out of bed, and I'd be on the couch for the whole day. I couldn't walk, I couldn't do anything.
Before this happened, before you became ill, what was the Smolders family life like?
It was,
I used to be in charge of everything.
well, it was nice.
Did you work then?
No, I didn't.
You didn't work before?
No.
Ron was the breadwinner. You
Right.
stayed at home, kept the house and the kids.
Yeah. And I really enjoyed being a mother. That was sort of my thing to do.
You have subsequently had to go to work.
Yeah. and I don't like it. I miss being at home. I miss being here in the morning when the kids go to school, or when they come home in the afternoon after school. I miss being here to ask them how their day has gone, or, you know, if they have their homework, and the little hugs and kisses, and doing things with them, special little things with them that you can't do when you're working all the time. That's gone, and it'll never come back.
Have your doctors offered you hope? Do this, things may get better.
Well, they've told me the exercise might help, and then they come up with this cycloplasmide. I don't even know how to say it.
Cyclophosphamide.
Okay. Experiment, and they said it may help, so I said, okay, I'm going to try it out. You know, they needed guinea pigs, well, I'm a good one for it.
You accept that role of being part of an experiment, of being a guinea pig?
Oh, yeah. I'll try anything.
For a guy like Ron Smulders, what are the benefits as you express them to him, and what are the concerns? What are the,
well, the concerns
disadvantages?
The disadvantages are the side effects of the treatment.
Which are, in this case?
In this case, if he were to receive cyclophosphamide, which he was randomized to receive, a month in hospital, hair loss, some nausea and vomiting, and a risk of infection, together with perhaps a long-term risk that the treatments might have some long-term adverse side effects.
Adverse side effects?
Well, whenever one gives chemotherapy, cancer chemotherapy, to a patient who doesn't have cancer, one's always worried that one could trigger a cancer developing in the system later on. Those risks appear to be minimal or non-existent, but it's a theoretical risk.
What have they told you about the possible side effect?
The worst is possible cancer of the bladder, or some other cancer rare. Well, cancer's cancer, they got cures for it. MS, they don't. No, if I get cancer, might be 10 years down the road, they got a cure for that. I'm not worried about it. I'm worried about what I got.
But at the Kaiser Permanente Medical Center in California, Dr. William Lukosky may already have the answer that the Canadian experiment is searching for. He's just completed his own study on cyclophosphamide and multiple sclerosis. Did it work? What have been your conclusions?
So our conclusions were that it didn't work. It was no better than our placebo, which was a vitamin.
You're saying that the results of the year were that it didn't make any difference whether you gave cyclophosphamide or not. The disease progressed in the two groups the same way.
Correct. Within a range within an experimental range that we considered very acceptable, it made no difference what they got.
As a physician, what concerns do you have about the possible side effects of cyclophosphamide use?
Even though we didn't show significant ill effects, that is, long-lasting ill effects, we're still very concerned about the use of it. Number one, it causes hair loss, irritation to the bladder, and then long-term, we're concerned about tumors. Infertility and tumors are the two potential long-term ill effects.
You're also aware there's been a study done by Dr. Lukosky in California.
Yes,
which,
very well. I'm very well aware of that study.
Which has shown, in that case, that there is no effect. There's no benefit to the use of cyclophosphamide.
That study began about the same time ours did. It was a very well-designed, controlled study, and you're right. He could not confirm the observations that they'd made in Boston.
He said there was no effect.
He said there was no effect.
If you took the placebo, or if you took cyclophosphamide, if you took anything else, he said, or nothing, the effect would be the same.
That's right.
So here you are in the middle of a tremendously ambitious and expensive study
Yes.
to try to address the same question.
Indeed. Well, I think when that kind of situation arises, that contradictory results occur in the face when another trial is ongoing, one has to face facts. Do we stop? Do we pull out? Was that study definitive or not? Or do we carry on? Our study has certain advantages and is designed to answer more than one question. And with all respect to Dr. Lukosky's group in California, it was a good study, but it doesn't answer all the questions that we were looking to answer. And it was never a serious question that we should stop what we're doing.
Does something like cyclophosphamide a certain attraction to a researcher that a less technological, less adventuresome means of treatment might not?
Sure. I think within each of us is a feeling that if you have a dreadful disease, that it will be extirpated with a dreadful medicine. And I think many patients have a feeling that, that perhaps if they hurt enough, they'll get better. Well, I think there's a glamour on the part of many people to use powerful medicines, whereas medicines which may be less dramatic, such as aspirin or a walk in the park or weight loss or exercise, may be less glamorous.
Pierre Rousseau and Ruth Brennan have been part of one of those less glamorous studies on the treatment of MS. One which was started by this man, Dr. Roy Swank, at the Montreal Neurological Institute back in 1949.
How has it been this year?
They're two of the 150 patients with multiple sclerosis who were put on a low-fat diet by Swank and observed over 35 years.
And grandchildren now, my family.
Though Swank's approach has been dismissed by many MS researchers, the results of his work were recently published by the American Journal of Clinical Nutrition. The 35-year study showed that patients such as Ruth Brennan, who went on the diet shortly after her MS was diagnosed, were 50% less likely to die. And in general, those who followed the diet were less likely to become severely disabled. For Roy Swank, it all began when he discovered that Norwegian fishermen who consumed very little fat seldom contracted MS. His study started shortly afterwards. What have your conclusions been? What happened?
Conclusions have turned out to be that these people are extremely sensitive to fat, animal fat.
Are you talking about something from your results which reduce the frequency of attacks and the severity of attacks?
Both a moderate decrease in the fat intake caused a decrease in the frequency and severity of attacks, and a marked decrease in fat also stopped the progress of the disease.
Almost 40 years have gone by since you began. Essentially, your conclusions were what?
My conclusion is it's very beneficial to patients. They're ambulant. Many of them have worked to a retirement, or most of them have worked to a retirement. The women, for example, are still keeping house and taking care of their husbands. I consider that a good result.
Having set out on the course of using the diet, how did your symptoms change?
Well, over a period of, months and then years, I began to get really better. And my vision, it took a long time for my vision to get better, but my walking did improve. I could never walk unaided.
Using the diet, being part of this study, working with Dr. Swank, how have those things affected your life?
Well, I was in absolute despair. I had a young, handsome husband and 3 small children, and just in a dreadful state of depression. And when I got to Dr. Swank, he gave me hope. He said, "You do as I say and you'll lead a normal life." And I have.
The diet that Ruth Brennan and Pierre Rousseau have followed is essentially very simple. Avoid fats from meats and dairy products, eat a well-balanced combination of vegetables, lean meats, fish, and fruit, add some polyunsaturated fats from fish and vegetable oils every day.
Since I've been on that diet, and for so long, I am convinced that the diet is responsible for my well-being today. I never expected that I would reach retirement age when I was started the diet, but today I'm convinced the diet has made it.
If that belief in the power of diet hasn't convinced many of Dr. Swank's North American colleagues, that is not the case in Great Britain, especially in London at the Central Middlesex Hospital, where another study involving 80 patients who were tested for 3 years has examined the use of a low-fat diet to control multiple sclerosis. The results here were also positive. Patients who stayed on the diet appeared to be better off than those who didn't. They had fewer and less severe attacks of MS. Sally Fiber is 53. She's had MS since she was 14 and has been on the diet for 8 years. What about the diet? Do you believe that that is helping you?
Yes, I do believe that's helping.
How do you know?
Only that I have remained fairly stable since I have been on the diet. That's the only way that I can really know.
Shirley Siegel contracted MS 25 years ago. She's followed the diet for the past 7 years. As far as you're concerned, has the diet, specifically the diet, had an impact on your condition?
Oh, very much so. When I had MS, I've had it for 23 years, I was going down. I don't say that the diet's a cure, but it's helped me feel better. It's given me more energy. It's very pleasant foods, salads, green vegetables, fish, which I'm very fond of. I don't find it a problem, but it certainly made me feel healthier.
Dr. Alec Forte is resident physician at the Central Middlesex Clinic. If you had multiple sclerosis? Is there any doubt in your mind that you would do this?
There's absolutely no doubt at all. I mean, if I had multiple sclerosis, this is exactly the kind of program that I would certainly follow. I can see no reason, personally or from a medical point of view, as to why I shouldn't, but I can see many reasons why I should.
In some cases. But back in London, Ontario, Dr. John Noseworthy, who runs the cyclophosphamide study, remains far from convinced. Where, as far as treatment is concerned, do you place diet?
I'm afraid my answer would be pretty standard for the medical profession.
Which is?
Which is, it has little to no role.
How do you deal with Roy Swank's work, then?
We would challenge those who've come up with suggestions about diet to allow that kind of work to be properly tested in a clinical trial, the same way we test other regimens for the care of these patients. Studies that have been done to this point have not shown that altering diet affect the natural history of multiple sclerosis in a robust way.
Dr. Noseworthy's opinion of the value of the diet is essentially the official position of the Multiple Sclerosis Society of Canada as well. We contacted the 13 MS clinics across the country, and we learned that not only do none of them actively use the diet in treating their patients, none of them even recommend that their patients try it. Nor were there any ready sources of information for MS sufferers about the British or Swank diets through the clinics or through multiple sclerosis patient support groups. All of that despite the fact that the official publication of the International Federation of Multiple Sclerosis Societies, this book called Therapeutic Claims in MS, says that people treated with the diet early in their disease benefit most, but the treatment with the diet reduced the severity and duration of relapses at all levels of disability and duration of illness. In other words, the diet may work. At home in Oakville, Ontario, Pierre Rousseau certainly believes that it does. He was diagnosed as having MS 38 years ago, and at the beginning suffered several disabling attacks. But in the subsequent years, Rousseau has had a successful business career and is still physically active and generally in good health. He has no doubt it is because Dr. Swank prescribed a low-fat diet, and he stuck with it.
Try it, you got nothing to lose. And if it turned out to be like me, you'll be back on your feet in no time at all.
Ron Smulders is still on his feet, though for him, walking becomes more difficult every day. He is one of the subjects of a high-profile and expensive experiment into the use of a powerful drug to control multiple sclerosis. It will be at least 9 months until he and the other patients know whether their roles as human guinea pigs have paid off. Whether high-tech medicine will fulfill its promise to the 50,000 Canadians with MS, or whether the answer will be found in some other, less dramatic direction, which is still to be explored.